the middle of the night and all of a sudden your little one wakes up screaming. You're trying to figure out what's happening and you see that they're kind of pulling at their ear. You want to take a look, or you take them to the doctor that next day and they tell you that poor little ear is red and you've got an infection. So what's our typical course of action here? Well, if they see redness or they see a fluid or pus or anything like that, they're going to hand you an antibiotic. Well, let's rewind a little bit. My name is Dr. Donna, and I am a pediatric and family chiropractor here at Innate Family Chiropractic, and today we are going to learn a little bit about ear infections. So ear infections, unfortunately, are a little too common nowadays with our littles, but there's also a couple things that we don't necessarily hear all the time with ear infections. Number one, a lot of ear infections are actually viral. But what's the first thing that gets handed to us at the doctor's office is an antibiotic. Nobody can truly determine if that ear infection is bacterial or viral just by looking. They just can't. You must culture something, wait at least a day to then determine if it's a bacterial type infection. If it is, then that antibiotic, which is meant to treat a bacteria, can be put hand in hand. If that ear infection is viral in nature and we give them an antibiotic, what happens? Sometimes it goes away because it just wipes out everything in the body. Sometimes things get worse, and sometimes about 4 to 6 weeks later, we have the exact same symptoms. We don't want that reoccurring pattern to happen because the only thing that that's letting us know is that that immune system is getting weaker and weaker and weaker. Because you see, when we take antibiotics for a viral issue, what ends up happening is our poor little gut, all the bacteria, good or bad, everything gets wiped out. So whatever chance our body naturally had to fight things off, it's no longer there. And so 4 to 6 weeks later, the same issue starts to happen because it needs help. It needs support. Your immune system just can't do it. So what are we going to do instead? Well, we get to watch and wait. I mean, even if you look up on the CDC, that's one of the first things that they recommend doing because these ear infections can clear and be done on their own. Now, my watch and wait protocol is a little bit different. Nobody wants to see their little one screaming or in pain and not do anything about it. Absolutely not. So what we're going to do in the meantime is take very amazing natural approaches to help that body do its thing. Number one, we're going to start with chiropractic. Now you're probably wondering, hold on, what does a chiropractor have to do with an ear infection? Fantastic question. With an ear infection, we see that we find a misalignment a lot of times at the top of the spine. The nerves in the top of our spine go directly into our brain and that ear canal. And if we have a misalignment, then that can cause a drainage issue. So what we're going to do as chiropractors is we're going to look at that entire spine. We are going to see if there's any stresses along the spine, and we are going to clear those stresses, or subluxations as we refer to them as, through the adjustment. A child's adjustment is so nice and gentle, and it's so effective for allowing that body to self-heal and self-regulate and allow things to drain and that immune system to ramp up and heal. Number two, we're going to make some dietary changes. An ear infection is an inflammatory type problem in the body. The worst thing that you can do is have an inflammatory diet at the same time that your body's desperately trying to fight something off. That means dairy, wheat, corn, soy, out the door, unless you want this to continue. And guess what? A lot of times with these ear infections, you probably have some respiratory things that are going to start too, because that gut and respiratory lining goes hand in hand, and it starts to move up because everything's trying to come out. So dietary, we got to cut all those things out. Number three, we might introduce some certain supplementation, or we might introduce certain oils, or we might do some garlic oil in the ear, a warm compress, whatever it might be. It's going to look very different for each child, but we are going to combat and come at the system as naturally as possible with as many things as possible to then allow it to do what it's meant to do, which is self-heal and self-regulate. The less we interfere with that process, the healthier and the better our systems are going to be for the long run. So if you want to take a natural approach to ear infections, chiropractic is your answer. We would love to be that support for you, and if you're nowhere near California, then I'd love to find you a fantastic chiropractor near you. If you have any questions, please let us know, comment below. But I look forward to seeing your kiddos and helping them thrive and live the most amazing lives out there.